informed consent has to be taken from the enrolled person, and there should be some, if there is an experiment and the person gives consent for that, he should have likelihood that he will get some benefit. It should already done on the animals first, and then the experiment should be subjected to humans. Avoidance of physical and psychological injury or harm. Benefit should outweigh risk. The proper experienced researcher should be there. The subject can withdraw consent anytime. Research must stop if harm is there. But however, in Nuremberg Code, there is no specific mention on children's about their ethics, unconscious patient, in the case of unconscious patient, what has to be done, or others who may not be competent to give consent. Declaration of Geneva, adopted at World Medical Association, 1948. It is amended in 1968, 1984, 1994, 2005 and 2006. Helsinki Declaration, it also deals with the clinical research and undergone 6 revisions. The Declaration of Helsinki is the well-being of the human subject should take precedence over the interests of the society and science. Consent should be in writing. Use caution if participant is in dependent or relationship with the researcher. There should be limited use of placebo. Participants should benefit from the research. Respect for human life. Consideration of the religion, nationality, race, parity, politics or social standing. Profession with consciousness and dignity. And health of the patient will be my first consideration. Respect the secrets which are confined to me. I will give respect to my teachers, the respect and gratitude which is their due. ICMR, this is apex body in India for the formulation, coordination and promotion of biomedical research. One of the oldest medical research bodies in the world, funded by the government of India. Hippocratic Oath is an ethical code for fresh medical graduates, written by the ancient Greek physician Hippocrates. Oath is taken during the convocation ceremony as a guide to conduct medical practice. Charak Shapath is the oath mentioned in Charak Samhita, a comprehensive text on ancient Indian medicine, authored by Charak, one of the early experts in Ayurveda, the traditional system of Indian medicine. It is originally in Sanskrit, but it is translated into languages such as Hindi and English. A translated quote from Charak Shapath says, "Not for the self, not for the fulfillment of any worldly material desire or gain, but solely for the good of suffering humanity, I will treat my patient and excel all." This is the Shapath. Now, from the old traditional system to the modern medical ethics, there is a rise of patient autonomy and transparency. This new ethical standard, which still prevails today, states that physicians do not automatically know what is best for the patient, and in fact patients are normally the best people to know what is in their best interest. So we have to, whenever we have to prescribe treatment, we have to discuss with the patient. Contemporary medical ethics is society allows doctor a degree of personal freedom in making decisions and in their interactions with the patient, but in giving doctors that freedom, society expects them to be able to defend their decisions and actions with reasons. Doctors must be able to show how their decisions and actions relate to the law and to the relevant guidelines. Modern ethics in current use, where it is used, modern ethics, it is in the hospitals and it is divided into 4 areas: hospital ethics, ethics and private practice, clinical research ethics, and ethics in public health. In the hospital, what are the situations where we deal with the ethics? It is withdrawal of the treatment for the dying patient or use of novel experimental treatments, informed consent for the procedures, and research work primarily takes place in the research work going on in the hospital. There is a role of medical hospital ethics, medical ethics. That's why nowadays every big hospitals have medical ethics. Institutional Ethics Committee is composed of 8 to 12 members. It has a chairman, 1 to 2 basic medical scientists, clinicians from various institutes, 1 legal expert, a retired judge, 1 social scientist from a voluntary agency, non-government voluntary agency, 1 philosopher or atheist, 1 layperson from the community, member society, member secretary. It is recommended by the ICMR 2007. Medical ethicists are the healthcare providers with training in bioethics, and their work requires one-on-one communication, tactful negotiation, and a firm grasp of the issues. It helps doctors resolve problems with patients or their families, as well as many other ethical issues in the hospital. Hospital Ethics Committee bring together professionals from variety of disciplines, including doctors, nurses, social workers, and lawyers. Their work is mainly advisory, and functions include developing hospital policies on key issues such as end of life,